we've been talking about the vagina has a lot of normal flora to keep it bacteria, and the thing is that the vagina is not a sterile place. A big part of keeping that healthy is having bacteria there to kind of maintain it's just a normal environment for the vagina. And so what happens is it's very anaerobic. A lot of bacteria, as you know, has a lot of anaerobic metabolism, which results in a lot of pyruvic acid, lactic acid. And basically what I'm trying to say here is that the vagina has a very acidic conditions. So not optimal for the pH. I think the vagina actually has a pH of, I think, 6, or at least at a pH of 6, the sperm are no longer functional. Not functional. And so that's a very acidic environment that it's going to encounter. But before it even encounters that, it's going to encounter an acidic environment in the urethra of the penis. As you know, urine is very acidic. Well, not very acidic, but it's acidic enough to mess with this, because if that's the optimal pH for it, that's not urine. Urine has a lot of uric acid, hence the term there. And what this is going to do is it's going to, it can mess with the sperm, and it can inhibit it and interfere with it. I don't want to say inhibit, but it can interfere with it. So what we have to do is we be sure that we have a lot of alkaline secretions from the seminal vesicles. All right, so let's moving on. So we've talked about the seminal vesicles. Now we're going to talk about the prostatic fluid. Yay, yay, yay. And this is about 20 to 30% of the actual semen volume. And here's what I think is funny, is that prostatic fluid, well, we talked about how crucial, alkalotic environment is. They're going to release off the bat ascorbic acid and citric acid, which is vitamin C and nutrients. And I'm sorry, but I cannot help but laugh and imagine that, the Survivor man, Bear Grylls, drinking his own semen, saying it's the excellent source of fructose and vitamin C, and the citric acid will provide me with nutrients that I need to survive in the wilderness. I could definitely see that happening, because the semen does contain ascorbic acid and citric acid, but what these basically are is just nutrients for the developing sperm as it travels through there. Now, this is something that's incredibly important. Says prostatic fluid contains seminal plasmins, which has a very antimicrobial or antibacterial properties. This is why I drew a picture of a bacteria and no sign. So, if you ever wondered why men, aside from the physical barrier aspect of it, the physiological, or I guess you could say the anatomical aspect of it, but the physiological reason why men are going to have less urinary tract infections in their life than women are is because our semen contains seminal plasmin. It contains antimicrobial properties, or antibacterial properties, I suppose I should say, not antimicrobial, antibacterial. Let me write that out right there. It's antibacterial. Antibacterial. And so if you're trying to convince a woman to swallow, say, hey, you got a sore throat, well, hey, why don't you try guzzling your own jizz? It's got antibacterial properties. I don't know how valid of a statement that is, but it is something worth considering, and fructose. So, Also, the prostatic fluid is going to contain thrombin, what is thrombin going to do? Well, thrombin is going to convert that fibrinogen to fibrin. And this is not just limited to sperm. This is something that happens, or this is not just limited to semen. This is something that happens in your blood. So thrombin is going to convert that fibrinogen to fibrin. And so whenever we, ejaculate, or I guess the slang term, busted a load, it's clotted semen, and that's why it's very, very sticky. It has a lot of this textures to it because of that. And this is going to, again, like we said, going to help it out. So I guess a big question for this is that, and I guess we'll address that later. But now I want to move on to the Cowper's gland, or otherwise known as the bulbourethral gland, and as it's colloquially referred to, it secretes precum, which is it's 5% of the total volume of it, and it's a very alkaline mucus. And remember when we talked about how when we in the ejaculated semen, it's clotted because of that fibrinogen of the seminal vesicles has now been exposed to the thrombin of the prostatic fluid, which is going to result in the conversion to fibrin, which is clotting, very coagulative. And so what we need to do is we release this alkaline mucus called mucin, which is it's a complex polysaccharide, and it's very, very slippery. And what it's going to do is it's going to lubricate the urethral linings in such a way so that it can't clot up. It's so, I think of it like Velcro. Velcro doesn't really work in, or I guess a Band-Aid, it doesn't really work in water. It's going to keep it slippery so that it can't clot up in the process of ejaculation and the process of expulsion out of the body. And that's, of course, something worth looking into. Okay, so last but not least is I want to talk about the actual penis, or it's an intromittent organ, or an organ that's going to be to put into. That's what intromittent means in Latin. I love word origin, and it'll help you out a lot. But there's basically these parts here, and this is a kind of, if we were to take a penis and we're just chop it down the middle in half and dissect it from the side, here's what we have. So we have this corpus spongiosum here, and this is I like to think of it because it starts with S for some reason. I think that's closest to the internal aspect of the body, but the majority of the erectile tissue is the corpora cavernosa. And all of this means is, like, corpus spongiosum means spongy body. All these are is just erectile tissues containing blood sinuses, which, I mean, and there's the corpora cavernosa is also in the clitoris of the female, but we're not talking about that for now. So what happens is when the male becomes aroused, when he begins to get erect, there is a nitric oxide released locally, and I want to make it clear whether this is it's locally released. So locally we're releasing nitric oxide, which is going to cause vasodilation, which is going to, of the arteries, arterial vasodilation, which causes them to dilate, which causes more blood to flow in. What that's going to do is, and that's what these blue labeled structures here is, and I think about that, the expansion is going to kink and it's going to compress the veins, and then of course after ejaculation, the sympathetic nervous system is going to control, and these arterioles are going to constrict. Therefore, it's going to shrinking up, it's going from that to that, which causes less blood flow in, and the penis will return back to its normal form. But what you have here is so nitrous oxide is released locally, causing vasodilation. That's going to cause an increased amount of blood flowing into these corpora cavernosa and the corpus spongiosum. So these blood sinuses are going to fill up, and the penis will become erect. At the same time, though, this is exerting a lot of pressure down on these veins. So these veins are going to collapse. Well, they're not really going to collapse, but they're going to kink. Going to kink a little bit, and these little tighter, and so that's really hard to move blood flow through there. And so blood is flowing in, it's not flowing out as fast as it normally would. And that's actually why, believe it or not, they say, seek medical attention if you experience an erection lasting longer than 4 hours. Because what happens is if you have a boner in there long enough, it can cause clots to form in these veins. And that's a bad thing, because blood is not going to be able to move around a clot, and it could cause some other detrimental effects throughout the body. And that's for another time. But anyways, this parasympathetic response causes a release of nitric oxide and vasodilation. So that's why they say, do not take Viagra if you have nitrates for chest pain, for this may cause an unsafe drop in blood pressure. Because, whenever you have patients with, chest pain, and you give them some nitrogen, and they go, does that help? All right. That's what it causes, is this vasodilation, and that's the point that I wanted to make clear about that. Okay, and so after ejaculation, we have this sympathetic nervous system control causes these arterioles to constrict. And if these arterioles constrict, there's less blood flowing in rapidly through these corpus cavernosa and corpus spongiosum. And then obviously the arterioles constrict, the venuses can expand, and blood is leaving the penis at the optimal rate. And so it'll go back to being where it was normally. And I also do want to talk about just some parts here that we didn't really quite go into. There's these two areas, and this is around the ridge of your head, called the corona, or the crown. And then underneath it, there's this little flap of skin called the frenulum. Think about that little thing, whenever you, very poorly drawn picture here, but this is teeth, kind of, that's your tongue. That little thing at the base of your tongue, that's also the frenulum. That's a frenulum, not the same one here. Anyways, my point being that the corona and the frenulum these are the most sensitive areas of the penis. And we'll talk about more of this when we get into the human sexual response. And that's pretty much it for the subject of that. I'll make another video explaining the next steps, but I hope that's helpful.